coming down to our in-service today, we actually have Kerry Nguyen, who is the intake and program coordinator for the Nursing Center. And Ms. Nguyen is here to discuss what she does at Nursing Center and what the program does. Ladies and gentlemen, this is Kerry Nguyen.
Hello. Like Mr. Washington said, I'm Kerry Nguyen, and I am responsible primarily at the Nurturing Center for intake and also community development, so being able to share with other people what we do at the center. So as we go through this, I'm going to keep it really informal. So if you have questions about anything, just interrupt me, okay? And I left lots of information right there in the middle of the table that just outlines our services and some brochures for both of our programs. So feel free to take what you want, and if you have questions after we leave today, then just give me a call and I'll answer those for you then, okay? We are located downtown on Pickens Street, so just a few minutes from here. We are a day treatment facility, and we are family focused, which means we have the parents and the children attend each day that they're scheduled to be in service with us. We have two different programs. We have an adult program, which we call our center-based program, and then we also have a teen parenting program. If you work with any teenagers, you know that their needs as parents or soon-to-be parents are different from, parents who are 18 years and older. So we separated the groups so we can make sure that we meet both of their needs. Our center-based program is Tuesdays, Wednesdays, and Thursdays from 9 in the morning until 2 in the afternoon. If children are in foster care or are in relative placement, we still want them to attend with the parents. We do provide transportation for our families if they need that service. We have 4 different buses that go out and pick families up all over the Columbia area. Primarily, we're serving Richland and Lexington counties. But if we do say we serve Fairfield County and Newberry County, and we've gone to Orangeburg before, so based on where they are, I'll always go out and see where it is and visit with them once just to see if we can pick them up. And if we can't, then we'll try and find some other means of transportation with them, be it the Medicaid van. I know the Winsboro area has a transit system that some of the clients from the Winsboro area have used, so we'll try and help them get transportation if we can. While families are in attendance, parents participate in a parenting group that is partially psychoeducational in nature. They go over about 10 different topics related to parenting in one way or another. So things like play and behavior and discipline, nutrition, child development. It's a different topic each week. And they do all kinds of different activities in the group. One, to appeal to all of the parents' learning styles. Everybody learns in a different way, so we want to give them an opportunity to learn in the way that they do best. And then also, many of our parents are functioning on a middle school to lower high school educational level. And so if we're doing the same thing every day, it's boring, and they're not going to be able to focus and get a whole lot out of it. So we try to do stuff differently every day, so art and craft activities, guest speakers, discussion groups. We take field trips if it's appropriate to the activity or to the topic for the week, something different every day. It also functions as a support group. Got lots of parents in that group, all different levels, so people who are about to have their first child, some parents have 7 children already, good mix of people in between, and so it functions as a support group to get support from not only our staff but other parents who may have similar experiences. Many of the parents who are attending have also been exposed to childhood physical abuse, sexual abuse, neglect, domestic violence, so they've got a lot of their own issues as well. And for them, just working with them, it's easy for them to get support from people who are going through what they're going through, have had the same kind of abuse history or similar to that in the past, so they get a lot of support as well. There are services that are available for all of the parents while they're at the Nurturing Center that are not required, but if they'd like them while they're there, they can get them. The first is case management. So every parent is assigned a case manager, and that case manager works with them to make sure that if they need to look for housing, if they would like to go back to school, be it for their high school or college education, if they need any kind of public assistance, things like that. They'll be working with them one-on-one to help them get those needs met, either directly from the center, or we'll put them in contact with people outside in the community who better meet that need. We provide individual and couples counseling. So if they need that, if they're required to do it, or if they have interest in that, that's something they can do while they're at the center. We work with LRADAC to do drug and alcohol counseling. So if that's something that they're required to do, or if they have interest in doing that, they can do that while they're at the nurturing center as well. And then we have somebody who I would consider a job coach. I don't know exactly what she calls herself, but she helps parents complete resumes, figure out which areas of employment they're best suited for, and then helps them get interviews set up, and prepare for their interview, know what to expect, that kind of stuff, to make sure that they are best prepared for employment. While the parents are in the parenting group or doing their counseling services, their children are going to be in early intervention classrooms based on age and developmental level. So we have one infant classroom, a young toddler classroom, which is about 15, 16 months up to 2 years old, an older toddler classroom, which is 2 to 3, and a preschool classroom, which is 3 to 5. So in those classrooms, they provide early intervention services. They will assess all of the children when they come into the center to see where they are developmentally. And then they will design treatment plans that work with that child, either to get up to where they should be age-wise developmentally, or if they are on target developmentally, to continue to move forward. Generally speaking, they work with them on things like socialization and peer interaction, cognitive development. They'll work with them on speech and communication skills, limit setting, so asking them to do something and having them respond appropriately, appropriate ways of self-expression, things like that. We have 2 speech therapists on staff who do speech therapy for any child who needs that service. We have several play therapists on staff who work primarily with the preschool age children, but usually 3 to 5, they'll work with them. They get a 30-minute session once a week, and typically they do that with all of the preschool children. And we also have a pediatrician on staff, and she's there just to interact with the children, observe them. If we need any kind of medical support, she's there for that. We'd rather the children see their primary care physician that they're seeing outside of the nurturing center, but if something comes up, she's there for that. We have a portion of the day where we have the parents go into the classrooms with their children and work on just general parenting skills, hands-on kind of things, and some of it can be very basic and general, like just knowing what's appropriate to do with their child, spending time with their child. Lots of the children are in foster care, and so they're only getting to see them twice a month, and so this gives them an opportunity to spend more time with their children, see them more regularly, work on bonding and attachment between the parent and the child, and like I said, any kind of parenting skills that they are unfamiliar with or don't know about, they'll work with them with that in the classroom, which I think is really important. We provide lunch, so during the parent interaction time, they will prepare and eat lunch with their child, and then after lunchtime is nap time or quiet time. So that's also an essential part of parenting, being able to sit with their child, hold them, rock them, help them settle down, read to them. If children do not sleep, they'll have quiet activities for them to do, because there will be children sleeping in that classroom, so we want to keep it quiet if we can. And after nap time, the children do remain in the classrooms for the rest of the afternoon. The parents will then have another afternoon group session, and then at 1:45, 2 o'clock, everybody's dismissed to go home. It starts out as a 10-week program, And we work closely with lots of other organizations that may be providing service to these families, including DSS, but Healthy Start, BabyNet, DDSN, all different kinds of places. Sister Care may still be working with these families. So after that 10-week period is up, we'll have a meeting with everybody involved, to include the parent, and see whether or not they would benefit from continuing past that 10 weeks. Some parents do come just 10 weeks, and that's a pretty low number. Most of the families are coming between 6 months and a year. And right now we have a lot of families who have been there for a couple of years. And the reason behind that is lots of these parents don't start our services until they're 18, 20 years old and up. So lots of things have happened to them, to their children. So at 10 weeks of service, you're kind of just scratching the surface really of what's going on. So as long as there's a continued need for service, we're there. So like I said, we've got I would say about 5 or 6 families now that have been there for 2 years, maybe even more than that.
Is that really indicative of the severity of the problem for someone to be there for years? If you're thinking that they need that long of length of time for services, could it be that their parenting skills are just that low where they need that kind of services?
Yeah, it's dependent upon the situation and the history with that family. And they may need to be there for years to work on being able to even be available for their child because their trauma has been so significant.
And how many times per week would they meet with you guys?
We'd like them to come 3 times a week, and they'll do the intensive parent group services, parent-child interaction services, and typically if they're participating in counseling, they'll do that once a week. If there's a significant need, then they can meet with them more than once a week. Typically it's once a week though.
Are these parents employed too?
Some of them are, and for parents who are employed, a lot of them it's just part-time work. So they'll work on the evenings, or they'll work the days that they're not coming to the nurturing center. And they, so far, have been able to arrange their schedules to do so. Mm-hmm.
Why could they provide and work part? I mean, these low-income people, because how could you work part-time and still be able to, pay bills and, I mean, I'm not, if they're there half of the day, and you say they're working at night, wouldn't that be like a conflict where they wouldn't be able to provide as much if they have a regular day job, 9 to 5?
Right. If they have a regular day job, they wouldn't be able to participate in our services.
At all? Okay.
At all. Because we don't offer any weekends or any evening services. Mm-hmm. So it would have to be for people who aren't working or who can arrange their work schedule to be able to come. If they are working or if they are in school, we will only require 2 days of the week, okay, as opposed to 3, which helps out some. And it's really dependent upon that person's schedule to see which 2 days will work best for them, and we are pretty flexible with that. Everything that families do at the nurturing center is free, so there's no cost to the parent or to any referring agency, which is also helpful too if they're required to do it. Makes it a little bit easier.
And by parents, are you referring to plural? Both parents are usually there, or is it just the mom?
Actually, we have a good deal of fathers coming now, which is an increase recently. We do have a lot more women than men, but we probably have about 5 or 6 dads coming now, which is, for us, an increase. More than it's been in years past.
About how many do you have in the program? I mean, at one time. I mean, obviously it starts out and then they continue, and then you have newcomers come in, and that changes the numbers. But what's the size of that you like to have?
Right now they have about 25 to 30 parents in the group.
Okay.
And based on how many children they have or what ages their children are, then that will vary in the classrooms. Typically they like to keep the classrooms 8 children or less, because they want to make sure that those children are getting the best service that they can. And they have 2 early interventionists per classroom. We also have some floaters. So if the classrooms exceed those numbers, we've got lots of volunteers who are trained, and floaters who are also trained that can move around in the classrooms to make sure that there's not too many children and not enough staff in the classroom. We provide home-based support services if needed. So typically the case managers will go out to meet with all of the clients on their caseload about once a month. I do intake, and so the intake is also done in the home. And usually I spend about 3 weeks with the family before they get started. Part of that is to cycle people out of the group so we have space to bring more people in. It's an open group, so there is no starting, no stopping point. People come in when they're ready, they leave when they're ready. But in the home before they get started, we go over all of the services that are available. We talk about some of our policies, our procedures for doing certain things like the reporting policy, things like that. I would like them to know how it works before they get there, just because I think it's fair. And we do an in-depth social history, so I have as much information about them as I can before they get started. We do a genogram, which is a family tree, so I have an idea of where their support systems are, what their family looks like. And then we do an assessment of their parenting skills and knowledge based on how they feel about it, which sometimes will give us an idea of some things that we can work on once they get to the center. And then I combine that with the information that I've gotten from the referring agency, if an agency has referred them, and then that will give us a starting point possibly for what we'll do once they get to the center. Referrals come from all different sources, so a parent can refer themselves if they'd like.
Large number of people make self-referrals?
Yes.
Really?
I would say about half of the people that we have at the center now were a self-referral.
Really? Young
And-
parents? Young parents? I'm sorry, what class would come into your population from self-referrals?
Our primary age group now is about 22 to 25, but we do have some 18-year-olds, we do have some 40-year-olds. The big chunk is between 22 and 25 right now. It just kind of depends. Lots of our parents hear about our services from somebody who has attended previously or is attending right now, so a friend of somebody. We have flyers up in the housing offices, doctor's offices, grocery stores, stuff like that, and they can just pull my name and number off and give me a call. Half of our families have DSS involvement, so some of the children are in foster care, some of them are in the home, and about half of the families have no involvement with DSS and are just really interested in getting some services and some assistance. So it's a good mix. We have a teen program that is on Fridays, and we work closely with primarily the Richland School District 1 high schools and middle schools. And it is very similar to the center-based program, but like I said before, teen parents have different needs, different issues, things they want to talk about, and so they want to make sure that they adequately address those for them. So Fridays is the teen program day. Teen parents who are in school are excused from school from 12 o'clock on, so they're at the nurturing center from 12 to 3. They do the teen parenting group. They do the parent-child interaction time, so they'll get some of that hands-on practice while they're there. And then they also provide counseling services for teen parents who are interested in that or who are required by DSS to do that. So they can provide that if needed. And they also provide lunch for them since they're there during the lunchtime hours, so that way they don't have to miss lunch. They provide transportation for that program as well. And children who are picked up or dropped off differently from where the parents are going to go, they can arrange that just like they do with the regular center-based program. Okay.
Oh.
And again, that program's free, so no charge for that. And that group is, the oldest one they would have is 18, and after they graduate high school, or if they're not in school and they're 18, we transition them up to the adult program. And I think the youngest we've had in that group is maybe 12 or 13. So they work with middle school and high schools. Primarily it's about 15 up, but we have had some younger ones in years past.
As parents?
As parents.
Or soon to be parents. So they'll work with any parent who's pregnant on up. So you don't have to have a child yet. And the same for the center-based program. If you're pregnant, then you qualify and we'll get you started in the program. And if you don't come with a child, so if you're pregnant, you'll still go into the infant classroom and they'll have you do all kinds of changing and feeding and doing things with your baby before your baby comes, like reading, listening to music, talk about what to expect during the delivery time and then after, just to get them, I mean, you can't be completely prepared, but as prepared as you could be before your baby gets here.
Do you get a lot of referrals from the hospitals?
We have some referrals from the hospitals, not too many though.
Is there a waiting list?
That kind of depends on how many people we have in the group and how long those people are staying. Sometimes we have a good idea of, a couple weeks before people get ready to leave. We start talking about it, preparing them, so it just kind of depends. Usually not though, because of the nature of the group and it being open. People do cycle out. And we do like to prioritize, so because I'm meeting with them for several weeks in the home, sometimes I have a good indication of priority in getting this parent started. So we try and maintain that as best we can too. So if it's an immediate need, we can usually squeeze them in.
Do you find that you turn away a lot of parents or very few?
Very few.
So you try very hard to furnish anybody who's asking for services?
Yes.
Okay.
And because we get referrals from DSS, they aren't necessarily always willing or cooperative or are excited about doing the parenting classes. So the nice part about how we do things is because I go out to the home, because we spend a lot of time one-on-one, usually after the meeting or two that we have, they're a little bit more open and willing, and they see it more as a choice as opposed to something that they have to do, because there are consequences for their choice to not do it, but it is their choice. And so after we talk about it, they seem a little bit more comfortable. So even the ones that I've worked with who've been really resistant at first have started, and it's gone pretty smoothly. Not always, but most of the time.
So in that 10-week program, and I know you said you do the parent-child interaction, observing that. Does that start initially
Yes.
at the beginning? Okay.
It starts the first day that they're there.
Okay.
All interaction between parents and children, whether they have DSS involvement or not, is supervised for liability reasons, but then also about half the parents aren't allowed to be left alone with their children. And so even on the transportation system, we have an aide on the bus who's there, one, to make sure children's needs who are coming without their parents are met on the way in, but then also to supervise, because some parents who are not allowed to be left alone with their children are riding in together. So we want to make sure that everything is safe and appropriate. And like I said, we work really closely with all the caseworkers or people involved, and we want to make sure that what we're doing at the nurturing center with these parents is in line with what's being asked of them to do by their outside caseworkers or organizations. If the children are receiving any kind of physical therapy, speech therapy, anything like that, early intervention outside the center, our early interventionists want to work with those workers as well to make sure that we're overlapping in an appropriate way, I guess, and that the services they get are beneficial and not confusing. So if they're hearing one thing from them and one thing from us, it could be a big mess. So
I think one problem a lot of our parents sometimes face is the behavior problems that sometimes their parenting skills are not appropriate. You guys address issues, say the mom with that middle school age child, 6th, 7th grade, or whatever, who's had behavior problems, and she may want to use corporal punishment to sometimes get out of control. Is that something you guys can address with parenting skills?
Mm-hmm. They do that, and they'll do that in the classrooms with them. Even if it's not the child that's attending with them, there's still similar issues going on with the kids that they're coming with. At the nurturing center, we don't allow any hitting, popping, spanking, screaming, and yelling. I mean, none of that is allowed. And we talk about that in the home before they get there. And part of our job is to help them find healthy ways of disciplining, learn the difference between discipline and punishment. And so they'll work with them in the group on that with the other parents, but then in the classrooms, I mean, children are different, and so it's what you do with one may not be what you do with another. But most of the time, some of the stuff is similar, so they can address it with them even if they're not coming with that older child.
Do you have an age limit on the children?
Typically, it's 5 years old or younger because they, once they're over that, are going to school. We have had recently, within the past couple of years, some 6-year-olds coming because they were having a really difficult time functioning appropriately in the school setting, and the school just wasn't equipped to be able to deal with that. They've got 20 other students in their classrooms, which is understandable. And so they've been excused from school 2-3 days of the week to come to the nurturing center to do the play therapy services, to do the early intervention behavioral services. And it's really dependent upon the school's willingness to allow that child to be excused during that time. And in the past, they've been excused for 2 days, so that way they don't miss too much educational stuff from school.
What could be a reason for a client to be asked for non-compliant not to come back, or feel that you can't help them?
Obviously, we go through like no weapons, no drugs or alcohol, so you can't bring any of that stuff to the center. Because we're working with parents who do have substance abuse issues, we go over, they can't come drunk to the nurturing center, they can't come high to the nurturing center, can't bring any of that with them. So if that was a problem or an issue with them and that continued to happen, then they wouldn't be allowed to come back. If they are physically fighting or assaulting staff or other parents at the nurturing center, which since I've been there has only happened once, they can't be there because it needs to be a safe place, especially there's lots of children, lots of people there. And attendance has been an issue before, where because we pick them up, there really shouldn't be a difficult time getting to the center, which you all have worked with them before. A lot of times transportation is a huge issue. So because we're picking them up, there shouldn't be a problem with them not coming. But because there is, it's unfair for us to hold a spot for somebody who's not coming when there are people waiting to come in who may be really willing to be there and be there like they're supposed to. And we go over that before they get started. So if attendance is ever an issue, we talk about it with them, we give them a fair chance to correct it, and if they don't, then we'll have to discharge them. But typically those are the only reasons. We have had families come, actually not too many, but have had some families come who just simply by being there does not mean that you're participating. So when we're asking you to do certain things, initially it can be really difficult to hear what we're saying. But if you've been there for 6 weeks, 8 weeks, and you're not talking in group, you're not interacting with your child, that information is conveyed to that parent, but also to the caseworkers, because you're not getting anything out of it.
I have a question.
Mm-hmm.
We deal with like different parents who have, even though their kids are past your age group, but I believe a lot of, even though their age group doesn't comply with y'all, I wonder, do y'all just have like the parents? Because I have, seen with some parents just need, listen to you talk, they need just the basic of what you're saying, even though they won't have their child as to interact, but just to, with dealing with the, how to act, how to discipline, and just that stuff. Because some, I had one case where the lady, she was, she beat her kids bad. And so to teach her better discipline skills and stuff like that, I would think that'd be a good program for her kids are outside your age limit.
Mm-hmm. And I think just philosophy-wise for us, we really don't believe that you can work with just one and not the other, and so we do require that they both come. And I understand what you're saying, but just our agency doesn't do that. If that is something that they need, though, and they call us, we can help them find other resources. And most of the time I do that, and I'm totally comfortable doing that. So if you're looking for stuff for them that they could do without their children, you can give me a call, they can give me a call, and I'll help them find other places.
Okay.
Because I know that not everybody's going to fit into, I have a child 5 years old or younger. And not everybody's going to fit into, I don't work or work part-time. And I completely understand that. It's really important to work, and I get that. Also, if parents have substance abuse issues and they have to do LRADAC services and they have to participate in that intensive outpatient program, which is the same hours. What I usually do with them is we do intake, and I'll just meet with them weekly or talk with them weekly over the phone, whatever's easiest for them, until they complete their drug and alcohol treatment. And as soon as they do, then we can get them started at the nurturing center. So that way there won't be a lapse in time and won't be a lapse in support services. And then typically what they do after they graduate from their intensive outpatient is they go into something called relapse prevention, which is just, once a week. And if it's done during the daytime, they can be excused. We'll just take them over to LRADAC for that hour or 2 hours and bring them back. And that way they can do both at the same time.
Oftentimes, too, one of the recommendations we make is individual and family counseling. Is that something that the Nurture Center addresses?
Absolutely. And they'll do individual counseling. They'll do couples counseling when there are issues, particularly with the preschool age. I think younger is a little bit difficult play therapy-wise, but 3 and above. And then if there's issues that come up in play therapy, we always talk to the parent about what we're seeing, especially sexual abuse issues, physical abuse issues. It's important for the parent to know what their child is doing, what their child is saying. And because we're working with them, we want to make sure that the lines of communication are open between us. So our reporting policy works similarly. If we suspect it's happening, we talk with the parent about what we're seeing, and the parent can know who from the center is reporting and what's being reported. And from our perspective, it's only fair. If we're working with them, it's not going to be an anonymous report. And if it were anonymous, it would really hurt the trust between us and them and the support that they feel from us. And so in any cases where we've reported, I think it's gone relatively smoothly because they've known about it before. It doesn't mean they're happy about it. Doesn't mean that they say, yeah, go ahead and do it, but at least they know ahead of time. Yes?
What would you do or suggest for a situation where you have like divorced parents and they're both at each other's, they both are at odds on how to discipline, nurture, care for a child? Would you work with that type of family to help them deal with their parenting issues, especially if the child is in 2 different home situations and they're getting 2 different types of and conflicting parenting techniques and styles?
Sure. That would be dependent upon whether or not the 2 different parents could come to the nurturing center and that they could work in an environment where they would be together at some point. When the groups get large, like they are right now, they split the groups into 3 different groups because we don't want too many parents in one group. It's not beneficial. Not everybody gets something out of it. So they may be split in the groups, which may help them, but they would be together in the classroom working with their child. If we can't work with both of the parents, then it makes it difficult for us to address the conflicting parenting issues. But if they were able to come and work together relatively appropriately, then we could do that. And they could also do some counseling services individually and together, so that way, even though they're not a couple together, that they still are working together for the best interest of their child.
Thank you.
And when they do couples counseling, they really encourage them to do their own individual as well, because those issues may not get addressed appropriately if they're together in a session. So typically all couples also, I don't want to say they're required, but it's strongly encouraged to do individual as well.
I know in a lot of families there's typically a lot of conflict on one of them's labeled the bad parent, one labeled the good parent, and so there's some parenting issues that they need to work together on, or maybe through counseling issue, why is one parent always having to do the discipline and the other parent resents it or is always trying to be the good parent to counteract what the disciplined parent. I'm sure you come across that all the time, but I'm sure that's something that can be addressed.
Yes. And like I said, it's difficult, and especially with children who are in relative care, because they're with somebody that the parent knows, and the way that the relative may be parenting them is different from how the parent would like it to go. And what's challenging for us is, unless the relative is part of the treatment at the center, it makes it difficult for us to get them on the same page.
But the relative can be a part of the treatment?
They, it depends
Okay.
with this, what the situation is, but yeah, that's a possibility.
Okay.
And we have had situations where the mother and the grandmother do come, but again, have to work on that situationally and see how it goes.
It sounds very intensive and very time-consuming, I guess, and I must imagine these people having such a luxury of time. But you may mention it was some kind of service employment where they can work after hours or other shifts, whatever. So, okay.
And a lot of the parents that do come are low income, and they aren't working right now. So that's why employment is a piece that, we really try to encourage them to do, even if it is just part-time. And typically towards the end of their treatment, they'll really work with them on looking for full-time employment or getting back in school, whatever is most appropriate. And then they'll help them work on childcare, so that way once they go back, they've got their children taken care of.
So do y'all like network with companies to get them jobs, or y'all do they go out and find?
They have there's a person on staff who networks with other companies who are employing people and helps them do their resume, get job interviews set up for them, and then get them placed. I don't know if it's a guarantee, but she
Yeah.
tries.
I know a lady. Just want to know with this work for her. She has a child that he's 4, and he's having problems like in school. I know he's in school now, but he has like a speech problem, and he doesn't know how to interact. And the real problem is he wasn't raised around kids. He's the only child, and so he used to leave the mom's house and go to the grandmother's house. So he really never had interaction. Like most kids have child development with other kids. He really never had that too much. And so I think it delays his education. But I was listening to a lady talk about her son, and I was wondering, would she benefit from coming to a program like this? You think?
I think so.
And with a child as well?
And what you can always do is you can just call me and tell me, and I can meet with her, even if it's just once, just to give her the information.
She's not low income. They're not like I don't know if it's an income requirement, but she's not low income, but she still can qualify. Okay.
Yeah, there's no income-based qualification. So not everybody who comes is low income. Majority, yes, but not everybody, and not everybody in the group now is low income.
Okay, just want to make sure.
And there are parents who are working. They work, every other weekend and during the evening hours. So there are parents who have full-time employment, but it's done on hours that they're not at the center.
Yeah, she works with I think Westinghouse, so she goes in like 3 in the afternoon. So I know the time conflict will be pretty good for her, but I didn't know it was the income. So I'm gonna let her know about it.
Yeah, and if the kids are in school, we can talk to the school, and then we send them our attendance records every day, so they know.
He's
even
in
if
a
it's
private
preschool.
school.
Okay.
It's a private school, so it's But
Okay.
she was telling me some of the challenges, and I just wanted to make sure that I'm gonna let her know about it. I think it'd be a great program for her and her son.
Yeah, and I make sure that they know what the group looks like and who's in the group and what. Now, I can't prepare them completely, but I don't want anybody to get in the group and be shocked about what people say in the group or what people talk about in the group. They may still be shocked sometimes, but
Yeah.
I like to be upfront and honest with them, so that way they have some idea of what they're getting into.
Well, I will let her talk to you. But it's more so benefit more for the son. I
Yeah.
think both of them, but more so for her child.
And if that's the way that that's the case for other people who are coming there too. They can get something out of it, but
Yeah.
they're really coming there for their children. And we have other people like that too.
Okay,
Mm-hmm.
that's great.
Any other questions? Mrs. Nguyen, we thank you so much for your time.
Thank you very much for having
Thank
me.
you folks for attending.
By the way, she was over there had my little kids. I'm gonna get